once again, happy to be here and to deliver this video. We are at EAU 2026 in London. I am Francesco Del Giudice, Sapienza University of Rome currently, but the latest and former bladder cancer fellow at Guy's and St. Thomas's NHS in London. And we will be delivering about this program and fellowship. And I'd like to introduce my mentor and friend, Ramesh.
Thank you, Francisco. I'm Ramesh Thurairagja, consultant urological surgeon at Guy's and St. Thomas's Hospital. And yes, Francisco was very recently our bladder cancer fellow and completed this training program very successfully. And he's gone on to do some great things in Rome, both clinically and academically.
Oh, very good. So, Ramesh, so once again, 2026, training is key. Robot delivered the possibility to have a dual console, full experience. It's only about skills. How it works, the fellowship. Would you like to dive into the program for possible future applicants?
Yeah, so I feel, as a team, we have Professor Khan, my co-director, and Rajesh Nair, my other co-director. As a team of three, we introduce bladder cancer training in robotics, both for people who have not had much, I would say much experience, because I think it is important to come to our fellowship program with some level of robotic experience. And for those who have been quite competent with doing a robotic prostatectomy, for instance. And we cater to these different groups of fellows. The learning curves can be variable, but it gives the opportunity for us as trainers and the fellows this ability to work together in order to achieve competency at the end of the 1 year. It's a modular program. During the week, you would be exposed to at least 2 major robotic cases. Often it tends to be the robotic cystectomy, but it could be some form of very complex robotic reconstruction procedure. We also have the opportunity to undertake quite complex salvage robotic surgeries as well, and then from time to time we might get some exceptionally complex cases like robotic surgery in a transplant kidney patient, for instance. So the breadth of the sorts of cases that come through the service and that the fellows are exposed to is huge, essentially. Yeah.
And I do still remember, probably it was my second week we had this conversation in the clinic. It's not only about the skills that you develop over the fellowship, it's about how your mind would eventually open up surgically, clinically, medically, in relationship with your colleagues, friends, the nurse personnel, all about a community that by the end of the year would eventually boost you up, your medical knowledge, other than, of course, being fully trained on technical aspects. Would you like, Ramesh, to give more insight to this for possible new future applicants? Where do you see the future of this fellowship is nowadays going?
Yeah, so as to your first part, we actually have a large team. And in fact, it's not just bladder cancer, it's the urothelial service that the fellow would be joining. We have a multidisciplinary team meeting on Fridays jointly with our oncologists, both clinical oncology and medical oncology, and there's a large outpatient service that we run. The urothelial service has both the superficial aspect and the muscle invasive or metastatic aspect. So the exposure is there, as we always have said, both Professor Khan and I, that decision making is key. This is not something that's taught in books. This is something that comes with exposure and experience, and that is what the fellow will be getting in terms of having to make key decisions both preoperatively as well as intraoperatively at the time of surgery. And as for your second part, the future, the robotics is accelerating in terms of technology. We've seen that just here at the EAU with telesurgery, with one of our colleagues performing this major robotic procedure with the patient being thousands of miles away. So different platforms are coming through. I think as mentors, we have to continuously keep up to date with the different platforms, the different technologies that are being introduced to these different platforms, be it haptic feedback or micron assessment or laser procedures. So as things evolve, we will evolve, and so that our fellows will get the most up-to-date training. And we are also, I have to say, even within our modular training, not sitting back and leaving the steps to these modular processes as the same. We are evolving all the time because we see how patients improve with changes to what we do intraoperatively and postoperatively.
Very good. So I think this is good, and as a personal ends up, I am really, how do you say, incredible work, incredible fellowship. This is probably the job that has changed my clinical career, and hopefully the dressing of the findings that have been developed over the fellowship, I'm sure it will be coming over the rest of my life. So it's something I think as a young urology we need to advocate in terms to the young community. A fellowship training program at the end of your residency is really boosting your skills in terms of what you would like to become in the future. Guy's at St. Thomas is a broad spectrum of fellowship, not only bladder cancer, but other services. Has been for me, once again, the most important clinical experience of my life. I guess you might be joining very soon. And once again, thank you for all. And we will see you for our abstract on Monday.
Thank you.